Well, initially was seeking out vein care because for probably the better part of about 2.5 years, I was dealing with leg issues. My legs were constantly swollen. They were red all the time. I lost all the hair on my legs, and they were hot to the touch, and it was just so difficult for me to walk around. And initially, I did get a referral to an artery specialist, which they did take a look at my arteries, and they said that everything was fine with my arteries. And then about another 6 months went by, and I was talking with my primary care physician again, and they again referred me back to an artery specialist because they said that it was a possibly a circulatory issue. And when I went back in the second time to get my arteries checked, I was finally given a referral to the vein clinic, which I didn't even know was a possibility. I was under the assumption, because I'm not in the medical field, I was under the assumption that the artery clinic was going to take care of my arteries and veins, which come to find out wasn't the case. But once I got referred to the vein center, the staff was very friendly and knowledgeable. And with my first visit, they gave me information saying, this is what you have. Um, we can definitely get you in here. We can look at some treatment options. This is what we want to do first. And they gave me a really good action plan. Did forget to say at the very beginning, when this whole process started, I was not walking. Um, I know that they could see it all in my eyes. When I first went in there in a wheelchair, I was very depressed. At the time, I was on medication for depression because when I was younger, I was an athlete. I played baseball, I was in the military, I did a bunch of different things, and I've, gone through my life with all this other stuff. And then come to find out, you know, I get pretty much put in a wheelchair without any real crazy injury, which, it was a big shock for me. And it was very rare that I was out of it. So like my wife and my daughter started doing a lot of everything around the house. Like I couldn't even throw, simple things like throw the trash, wash dishes. It was just so hard for me because I couldn't walk more than 10 steps. It was a chore for me to walk from my bedroom to my bathroom, which is only 10, 12 feet away. And now, me and my daughter, we since my last procedure, which it's been about a month and a half, with the amount of walking that I'm doing now, I've lost about 7.5 pounds. And just going and spending time with my daughter, she's 12. So, it was going to be missing out on a lot of important things. She does a lot of stuff with her school, which I wasn't able to do because I couldn't get into stuff. Yes, they have accommodations for people in wheelchairs, but it was still very hard. The diagnostic process was actually really very simple. The staff was very friendly. They told me what was going to happen every step of the way. So I went into the there's a room, just like a patient room. And I laid down on the table, and they told me they were going to do ultrasounds of my veins on my legs. So there was no pain, even though I was currently in pain at the time. It was painless, the diagnostics. If you've ever seen an ultrasound on a pregnant woman or anything like that, they squirt the little jelly on you and then go over your veins. So about the whole procedure took maybe 20 minutes. And then I spoke with Dr. V. Dr. V explained everything to me about what my venous deficiencies were. That majority of the ones they're hereditary. And then come to find out that I am what's considered a vein maker. which I didn't know was a thing. And apparently, vein makers, um, even though my veins and I got these procedures done, since the very beginning, Dr. V told me that I'm probably throughout the rest of my life going to have these procedures at least again because I make veins. So even though they closed off the veins that were having issues, there's a chance for those to regrow. So again, the staff was very friendly. They let me know from the very first step that of what was going to happen, and then they worked with me, letting me know, saying, "Hey, we would like to get you the compression stockings to see if that's going to help." I was measured, and then within a couple of days, I actually got my stockings in, and I was wearing those. I actually still do because for me, it's a little bit more comfortable with the compression, even though currently now I don't have to wear them anymore. But I wore my compression stockings, which, helped with a lot of the swelling. I started getting my feet picked up every day. And this was all at the recommendations of the staff and Dr. V, to elevate my feet, everything, not to sit for so long, to get up, walk around, do general exercises. And it was, and this is all stuff that I knew, but being in the situation that we're in with COVID, I had forgot about my own health myself. So I didn't really think of anything like that. And then uh, it it was just a very easy procedure for getting diagnosed. The first, so I initially had four, or not initially, so total I've had four procedures. The first three were a laser procedure where they stuck a catheter from mid calf and they went up my vein to my growing area, and they actually cauterized my vein closed. They said it just heats up the tip with and they put some saline solution in it. And the Dr. V was very. He made sure he told me everything that was happening again. He said, "Okay, you're gonna feel a little poke. There's gonna be a little bit of burning sensation because they do have to numb you and stuff like that," which wasn't that bad. It was a little uncomfortable, but wasn't bad. It was probably the procedure took maybe, I would say, from start to finish about maybe 20 minutes, so it didn't take very long, and it was an outpatient surgery, or procedure, so I didn't have to be under any kind of anesthesia. I was in a wheelchair for about 8 months before I got into CVR. And when Dr. V saw me in my wheelchair for the very first time in my consultation, he told me, "We are going to get you out of that chair." And I'll be honest, I at first did not put a lot of faith into it because I had put a lot of faith into maybe finding something with my arteries, and it just didn't happen, right? So of course, being a glass half empty or glass half full person, whichever you prefer, of course I was like, well, I'll believe it when I'm walking. The first procedure happened, and I was not walking immediately. It was on one leg, and then I had my second procedure a week after my first procedure, which was the laser procedure again on my left leg. And after that second procedure, I was actually able to not completely get out of my wheelchair, but walk without, I was able to walk. I had to use a cane initially, and it was a bit rough. I could only walk maybe 20 or 30 steps initially, and then I had to rest, which was still not great for me, but it was better than what I had in the past. So about a week after that, I had my third procedure, which was also on my left leg. And after that procedure, I pretty much almost left the wheelchair completely. And after my fourth procedure, which was actually a venous seal, that one was not the laser, and that one was on my right leg. But after the venous seal procedure, I was able to leave my wheelchair completely, and I have not been back in my wheelchair for about a month and a half. It was a very emotional experience for me, and I can't say enough great things about the company, the staff, the knowledge that everybody had, and just the general willingness or the want to help somebody. So when I was finally able to stay out of the wheelchair was such a blessing on there. And the week that I went in for my week checkup after my fourth procedure, I got teary-eyed in the office. A lot of the ladies in the office, a lot of the staff was just, I just couldn't be more thankful. I don't, there's no way that I can thank them for what they've done. Now that my legs aren't so red and hot and basically angry anymore, I actually have hair growth back on my legs. I've started getting hair growth, and I had a lot of ulcers on my feet, which I was going to a wound clinic for. Those have since healed since my procedures as well. So I'm 100% healed on my ulcers, which Dr. V again told me, you have ulcers, we can see them. Those will be healed when we're done. But now I'm back to walking at my normal pace. I've always been a little bit of a fast walker, and now I'm just about back at my normal walking pace, which is really great. Again, my wife is so ecstatic. We've shared tears together about everything, trying to keep everything back right now, but she's excited. She knew how depressed I was when the whole thing started with me being in a wheelchair. She knew how much of an athlete I was, and now that I'm walking around again, and she's just saying, my doctor actually took me off of my depression medication. Yeah, he says my doctor. He went in. He's like, "How are you feeling now that you're walking around?" I said, "I feel great." He said, "What I would like to do is we want to test or it's not take your medication for a week, and if you feel fine, we'll come back in for a visit and everything." And I felt fine. I wasn't grumpy. I wasn't agitated or anything like that. And so now I've been off my depression medication per doctor orders for about 3 weeks now, and I can say I'm not depressed anymore. I know that I've said enough. I can't say thank you enough to the staff at Center for Vein Restoration, but I just, want to thank Center for Vein Restoration as a whole, not just that staff, but as a whole, for being there for their patients. And I just, if this helps anybody in any way that's been having, leg issues, that they don't know what's going on, and remember, veins are a big part of it. I wasn't aware of it. Just try to keep your health as best as you can, and if you're not satisfied with some doctor's recommendations, go get a second recommendation. It took me 2.5 years to figure out what was going on with me, and it could have been probably solved a lot quicker. Dr. V's office solved it in 2 months. And again, not just Dr. V's office, but the entire CVR family. I thank you from the bottom of my heart, and my family as well.